Here's what you should do if you received an AHCA administrative complaint or notice of intent. The first question is probably, well, why did I receive this administrative complaint or notice of intent? If you've received an administrative complaint for the Agency for Healthcare Administration, or AHCA, it means that they are alleging that your healthcare facility, i.e. nursing home, assisted living facility, skilled nursing facility, or home health agency, has violated one or more sections of the Florida statutes, the Florida Administrative Code, or both. AHCA will then make the argument that because you have violated these laws, that your facility's license should be revoked or suspended, and you may be required to pay an administrative fine. Typically, you have 21 days to respond to the complaint by disputing the allegations or admitting the allegations. Depending on your response and how your case is handled, you could have serious long-term impacts on yourself and your practice. AHCA may conduct unannounced inspections on any of the facilities listed or referenced before after AHCA has conducted its survey. The administrator for the facility will be provided with a survey report detailing AHCA's findings, including any deficiencies. These deficiencies will be provided to you in a statement of deficiencies. Deficiencies must be fixed within 30 days after notification and another 10 days to present a plan of correction. Many times these unannounced inspections occur if an individual has decided to file a complaint against your facility. AHCA then seeks to substantiate those claims that were made by that individual. Along with the complaint, you may receive a second copy of the Statement of Deficiencies and Plan of Correction from AHCA, which will contain conditions of participation that your facility was not in compliance with and the corrective measures that must be taken to comply with your license's requirements. How might this impact my healthcare facility or license? AHCA maintains a list of all actions that were filed against your facility, and if they were resolved via settlement agreements, defaults, and dismissals, or by recommended orders. These three outcomes can have different impacts on your license and ability to practice. They are all part of the public record. What should you expect at the Division of Administrative Hearings? The administrative hearing before Florida Administrative Law Judges governed by the Florida Administrative Code and Florida Administrative Procedure Act, Florida Statute Chapter 120. If you decide to deny the allegations and pursue an administrative hearing before the Division of Administrative Hearing, the case can still be closed or settled prior to entry of a final order by the judge if the parties can agree to negotiated terms. Hearings can either be informal or formal. At the hearing, the burden is on AHCA to prove clear and convincing evidence that the healthcare facility failed to act in a certain way or acted in a way that was otherwise prohibited. If AHCA can't prove this, then the specific count, notice of intent, or the entire administrative complaint may be dismissed. Examples of violations that AHCA may fine or reprimand you for. First, Director of Nursing. AHCA requires that home health agencies that provide skilled nursing cases must have a Director of Nursing at all times. If the DON ceases to be an employee at that facility, the AHCA must inform AHCA within 10 days or risk a Class 2 deficiency. Second are advertisements. A person that offers or advertises to the public a service for which registration is required must include in his advertisement the registration number issued by AHCA. Third, office hours. Home health agencies, administrators, or the DON or their alternates must be available to the public for any 8 hours, consecutive hours between 7 a.m. and 6 p.m. Monday through Friday of each week. Available to the public means being readily available on the premises or by telecommunications. If an AHCA surveyor arrives on the premises to conduct an unannounced survey and no authorized person is there to provide access to patient records within 1 hour of the arrival of the surveyor, then they have violated licensure requirements. Further, that list of current patients must be provided to the surveyor within 2 hours of arrival, if requested. Failure to do either may be grounds for denial or revocation of the agency license. Nursing homes and related healthcare facilities, such as home health agencies, have many statutory requirements, and AHCA doesn't care whether you intended to violate the requirements or not. They will pursue action against you. For example, there are certain director of nursing and administrative requirements. For example, staffing requirements, notifications to AHCA, limitations on staffing services, etc. that nursing homes and AHCAs must adhere to or risk fines and suspension of their license. What are some of the penalties? Well, there are 4 different classes of violations that exist, and the fines vary depending on the seriousness of the violation. For example, a Class 2 violation permits AHCA to impose an administrative fine in the amount of $5,000 for each occurrence and each day that the violation exists, while Class 3 only imposes a fine not to exceed $1,000. Additionally, AHCA may impose costs related to an investigation that results in successful prosecution, excluding costs associated with attorney's time. In other words, if you decide to fight the allegations and are unsuccessful, you may have to pay thousands of dollars in fines and fees related to your investigation. These fees may include reimbursement for attorney's fees. In addition to a fine for certain class violations, AHCA may request revocation of your license. Florida Statute 400.474 lists various actions taken by a home health agency that are grounds for disciplinary action and the administrative penalties that may be imposed by AHCA. AHCA considers the nature and severity of the violation, actions taken by the administrator and corrective actions, previous violations, the effect your violations had on facility residents, violation of the facility, and whether this was an isolated pattern or widespread deficiency. It's important to hire a competent health law attorney at the early stages of the investigation and subsequent hearings. Although it's not a guarantee, highly skilled attorneys might be able to mitigate the seriousness of the offenses in the complaint, resulting in the reduction or rescinding of fines and action against your license. You and your attorney should decide whether it is best for you to appear before an administrative law judge or negotiate a settlement with AHCA. To better weigh your options, a licensed attorney may submit a motion for extension of time to respond to the administrative complaint, so that you can negotiate a settlement or gather evidence to deny the allegations at the hearing. Alternatively, if you have already submitted your election of rights to AHCA, a health law attorney may be able to submit a motion for abeyance to continue the case while you explore available options with AHCA. Thank you for taking the time to look at my video. If you have any questions related to this topic or any other topics, please contact me at the information provided throughout this video. Thank you.